joining us. This is Betsy Nyman with Illinois Action for Children, and I am joined today by our partners in Advocacy for Early Childhood Education, the Ounce of Prevention Fund, Jonathan Doster, and David Lloyd, and Emily Miller from Voices for Illinois Children. So together we are going to try and make a little bit of sense of the proposed governor's FY16 budget, which we have now kind of been living with for just over a week and still trying to understand, but definitely wanted to get as much information out to the advocacy community as possible so that you can start talking about that locally and starting to understand it and clearly starting to advocate on behalf of early childhood education as we really in the General Assembly start to get into the discussions about forming an FY16 budget. We will, of course, address FY15, the current fiscal year that we're in, first, because that is our day-to-day reality right now. So with that, welcome everybody. And I believe we have lots of moving parts today in terms of we have multiple presenters, we have somebody who's controlling the slides, and we also have somebody who's going to kind of moderate and filter the questions. So with that, I think we can move to our first substantive slide.
Well,
I don't think I control. Oh, great. So we're going to start with David and really just try and get and have him remind us of an overview of the state's current situation. So David?
Sure. Thanks, Betsy. And this is David Lloyd with the Fiscal Policy Center at Voices for Illinois Children. So as you likely know, the FY15 budget, which started last July and goes through the end of this June, many programs, including most notably the Childcare Assistance Program, were not fully funded. And so they essentially what they did was they appropriated money for which there was not revenue to back it up. And the budget that they passed was based on revenue consistent with maintaining the both the personal and corporate income tax rates that expired on New Year's Day just 2 months ago. And so this has caused really terrible problems throughout the budget, especially with the election results. It became clear that that there was really no chance that they were going to come back after the election to maintain the rates. So both the personal and corporate rates decreased 25% on January 1st. And right as part of his FY16 budget, Governor Rauner has proposed a supplemental for the current fiscal year, which amounts to over, in total, and this is what this chart shows, over $600 million to fund areas throughout the budget that were not funded for this year. He's also taken a bunch of other steps, which many of you are probably aware of, in terms of not carrying out contracts and grants that that were appropriated. And most of this money, by far, in the supplemental, is in the Department of Human Services, and the vast majority of that is with the Childcare, the Childcare Assistance Program. The governor and legislators are still in negotiations right now about how to deal with the current year budget, and with the governor basically asking for very wide authority to move money around from various places in the budget to take care of the shortfall. And so I'll move on to the next slide. So the and Emily just mentioned to me that we may actually see a bill this week for a supplemental for the current fiscal year. So we'll be looking out for that. So there really are really deep problems with the current year budget. But a week and a half ago, Governor Rauner also proposed his FY16 budget, which the new fiscal year begins this coming July. And because of the expiration of the previous rates, because of the tax cut, the Governor's Office of Management and Budget says that there's a budget gap for next year of about $6.6 billion, which is a huge amount. That's basically, that represents basically a fifth of the general fund's budget overall. And to close this, in order to make the numbers work, at least in his proposed budget, he proposed slashing pensions and other benefits by $2.9 billion. He's also proposed slashing revenue sharing with local government entities by $1.3 billion, which really just shifts cuts to the local level from the state level. He's also proposed $1.5 billion in cuts to Medicaid and roughly about $900 million in cuts to the Department of Human Services, DCFS, Children and Family Services, Public Health, and many other areas of the budget. So it really is an extremely deep cuts in this budget, and because the pension cuts that he's proposed, we think at the Fiscal Policy Center would be almost impossible to achieve in FY16 because there would be there would doubtlessly be court action brought against it, and it would be very, very difficult to get those savings in 16. If those do not were not part of the budget, you would either have to raise new revenue or cut other areas more deeply. So the bottom line is really that Governor Rauner has really proposed a cuts-only budget, and that there is no revenue in what he's proposed so far. You can move to the next slide. And this cuts-only approach would really have a lasting negative impact on infrastructure serving children and families. As many providers know, there really is a system in place to help serve children and families. And once you kind of get rid of that system and start dismantling it, it's very hard to put back together again. And so the damage would extend beyond the current fiscal, the next fiscal year if these cuts are enacted. We at the Fiscal Policy Center also believe the revenue must be part of the solution, that it really, we cannot make the investments in children and families that we need to create a stronger Illinois with the current projected revenues for next year. That really is just not possible. And preschool and K-12 education, both of which saw slight increases, which will be talked about by others in the next few slides. Those things don't occur in a vacuum, and gutting investments in other areas that serve children and families can reduce the effectiveness of preschool and K-12 education. By asking more of these systems, by getting rid of a lot of the supports around them, decreases their effectiveness. And one thing that I wanted to point out was that Illinois residents now pay the lowest effective personal income tax rate in the Midwest. So, and that's including Indiana, which I think would surprise a lot of people. And the current revenue is just simply not enough to make the investments that we need in children. And so I'm going to turn it back over to Ceci for the next slide.
So this is Ceci. Thanks, David. So we've heard a lot about child care in the last couple of months. Unfortunately, it's for the wrong reason. We wish that there was this much coverage and conversation and attention being paid to child care for all the great things it does for children and families. And unfortunately, what the conversation is and has been is that the child care program, as you know, is facing a significant shortfall in our current year's budget. David laid out to us kind of how that came about. Child care is the first of a number of lines in the current year's budget that will not have enough appropriated money to it to make it to the end of our current fiscal year on June 30th. So there was not enough said, I think, enough detail about the FY16 budget in the governor's address, but he did prioritize child care. He did recognize it as a significant crisis that impacts thousands of children and families, and for that, we're very happy about. Unfortunately, it's now going on 2 weeks out, and we don't have a solution. David laid out some of the kind of possibilities in terms of, basically the governor has asked for the authority from the General Assembly to move money around as he sees fit, and that would be the best way, in his proposal, I think, to fix the child care crisis, which is short. Now the Department of Human Services is using the number $277 million. We've just generally used $300 million. That the flexibility that the governor needs, he does need the flexibility to move monies around, but I think that the General Assembly, both the House and the Senate, have felt thus far in their negotiations that that the authority that he's asking for is a little bit farther in reach than they are comfortable with. The General Assembly provides the balance between the executive and the legislative branch, and so they really do, and we always have, done a budget-making process in partnership, and giving all budgetary authority away to the executive branch really does kind of undermine the democratic process in Illinois. And so those negotiations are still ongoing. We had hoped that we would see a resolution before now, but we are hearing some indications that perhaps this week we will see a bill introduced that would start to address this problem. So just really briefly, I think we've been over for a number of folks around the state, but for those of you on the phone that kind of haven't been walked through this, the Child Care Assistance Program is a combination of federal and state money. We have expended all of the state money that we invest in child care, so that is the general revenue fund. I tend to say that is basically the state's checking account, and that really allows us to constantly have a cash flow in the child care program, because bills really do kind of come due every day, so to speak. Because the state has expended all of that general revenue fund at the end of January, we now are only relying on a once a month payment from the federal government of about $40 million into the state's child care checking account that allows us to start to move some bills. Unfortunately, that amount is not enough to pay even 1 month's bills, much less the fact that we are now pushing into March. So we've had an entire month of February, and now going into March, the state accrues bills every day for child care services rendered and provided out in community-based programs. And so right now, we understand that we're looking at about a 6-week delay, and that delay only gets longer and longer in terms of payments to providers, because again, the state will be able to draw down their federal money again on March 15th, but we have to finish paying for the bills that are outstanding from February before we can get to March. And again, even in the best of circumstances, $40 million is not enough to pay a full month's budget, much less half of February and all of March. So you'll see how we will start to fall farther and farther and farther behind. We are hearing from the field that providers now are being told that if you submitted bills after the 10th of February, you will be in the next payment cycle, which means that if you're next in line, you'll get paid some of that of what you're owed in March, and likely potentially April. So it's definitely, the delays are causing some real hardship. And what we're hearing is that is having a real impact on child care programs, clearly. We've heard a number of programs that have closed. A significant program in Aurora closed on Friday after many years in business and turning out over 60 families that lost their care. Because of these payment delays, very few child care providers were on a margin where they can float staff and other expenses without those dollars coming in from the state. So the impact is real. It's happening every day, and we suspect it's going to start to happen more and more as providers simply cannot go without those payments starting up again. So again, we are hopeful. We are working with you, our advocates, to really keep the pressure on so that they do address the crisis sooner versus later, and we can get that appropriated dollars into the child care assistance program and start to get back to business. So that's a summary of where we are for child care. It is unlike anything we've seen before in Illinois. So many of you have advocated and been very successful when we've had to go back for supplementals at some point in a fiscal year, but never to this degree, and never with kind of no end in sight in terms of, well, when will the money start coming? And so this is very much a very different situation, and that is why we really do refer to it as a crisis. It's also leading into and kind of setting the stage for what the governor did propose for FY16, that fiscal year that will begin on July 1st. So unlike many years in previous administrations where cuts have been proposed, they do an across-the-board cut. And this is not a kind of across-the-board 10% cut. This is individual programmatic lines have been kind of identified and cut. Does that mean that a lot of programs across the board have been cut? Absolutely. Everybody's going to be feeling pain in FY16. Many are already feeling that pain. But there are really some very specific cuts that are being proposed that will have a significant impact. There are 3 significant changes proposed for the Child Care Assistance Program that will ultimately diminish the program's reach and access to low-income families because they are so profound in terms of limiting access. So let me just go through them really quickly. The first change would be reverting back to a copay scale that we developed and basically used up until about 18 months ago. So it is the copayment scale that that Illinois used after the ARA reductions went away. So we had a significant drop in copays during the ARA years. Illinois received some federal assistance during the height of the economic crisis. We, in that time, developed a new copay scale that we feel is fair. It's just significantly higher than what many families can pay right now. And so my screen just went away. And so we, can folks still hear me? Yes, we can. Okay, good. My screen went away, but if you can still hear me, that's okay. So the first cut is a reverse, going back to a copay scale that will increase copayments for families to what they were about 18 months ago. So that is the first significant change in terms of the program. And what we know through our experience over the years is that many families, as they start to kind of go up that income scale, is that copays become so high that even though they still qualify for child care assistance, they can no longer stay in regulated care because they can't afford that copayment. So that's one significant change that we feel is really going to limit access to the programs for families. The second change is that, as you may know, the Child Care Assistance Program is designed to serve children birth through the age of 12, cutting off at your 13th birthday. The proposal in the governor's budget would eliminate, kind of basically limit the program for children 5 and younger. So as of July 1st, no new children coming into this program who are 6 or above would be admitted. So it would really be stopping intake for school-age children ages 6 and above after July 1st. If we have the school-agers that are currently being served in programs that are in the Child Care Assistance Program right now, as long as they can maintain their eligibility and stay in the program, they can continue to receive care. But no new families would be admitted into the Child Care Assistance Program. And as many of you know, families' work habits kind of cycle in and out of employment. And so what we fear is that many of those families aren't ever consistently eligible for a year at a time. And so if they become unemployed for a brief period, they then lose their eligibility. They become reemployed, but they unfortunately cannot get back on the Child Care Assistance Program if their children are school age. This is a significant change in the program. The only other state that we've heard has kind of entertained this, and we're still trying to figure out to what degree they've implemented limiting the program from school agers, is the state of Florida. So this is pretty significant. It represents a pretty significant cost savings for the state, but really we are very fearful for what this is going to mean for children and families in terms of what they do with their school agers, the walls that they'll be backed up against in terms of making choices. Do I leave my kids home alone, let them go home after school by themselves, or do I quit my job so that I can be there when they get home from school? So a pretty significant programmatic change, one that we clearly have never seen before in Illinois. The third programmatic change that the governor proposes in the FY16 budget is, as many of you know, right now we have multiple forms of care to really uphold the priority at the federal level when the Child Care Assistance Program was created, and that is parent choice. So we have licensed centers, licensed homes, and then we have licensed exempt homes. Those fall into two categories. Those providers, those licensed exempt providers who are related to the child they care for, and then we have a segment of licensed exempt providers who are not related to the children they care for. The governor's proposed budget would eliminate the related caregivers from being part of the Child Care Assistance Program. This is a significant change. Many families who are English language learners, who have a cultural background that is different than American and want to find care locally that is in their own language, that is in their own culture. Many families who work variable work schedules, who don't fit a Monday to Friday 9 to 5 or 8 to 7 work schedule, they can't access center-based care. They have to rely on related or unrelated caregivers that are licensed exempt, because those are the caregivers that really do tend to provide much more flexibility for those work schedules. So to eliminate the caregivers who are related to the child they care for from participating in the Child Care Assistance Program is significant. Of the three programmatic changes that are proposed in the FY16 budget, this has the greatest budget impact in terms of what the estimated savings for the state are, but it also potentially has the greatest impact on children and families across the state. Illinois is one of kind of the three top states in terms of the number of licensed exempt caregivers that we have as part of our Child Care Assistance Program, so we're out there with New York and California, and that makes sense. We're the third largest school system as well in the Chicago area, and we are the third largest, most populous state. And so we have lots of different employment needs, and so we have lots of different employment habits and schedules, and so we have to create systems that support that and respond to that and reflect that reality. So those are the three programmatic shifts in the governor's proposed FY16 budget for childcare. I talk about, as opposed to talking about budget cuts, I really am focusing on the programmatic shift, because while they don't necessarily, the numbers are very confusing. Childcare numbers have always been confusing. They're in multiple lines. They're across different categories. But understand that while these aren't kind of put out there as budget cuts, they will absolutely have an impact on the size of the child care budget, because they will limit the access. And the fewer people that you let into the program, so to speak, then the less money that the state pays out in terms of supporting those families. So it is a roundabout way of doing budget cuts. It's unclear what the actual quote-unquote cost savings will be to the state. They have some estimates out there. So that is being figured into what they assume their FY16 appropriation will need to be. And we're still really trying to understand what some of those assumptions are and what some of those estimates are. But just understand that when we talk about programmatic cuts, they do have a significant budget impact. They simply aren't put out there as budget cuts. They're put out there as programmatic cuts. So hopefully that makes sense to folks, and that really does kind of take us up to where we are right now, both in terms of our 15 budget, but then in terms of giving a glimpse of what we have ahead for the months ahead in the General Assembly to really talk about and advocate for a better FY16 budget for childcare than what was laid out by the governor. So with that, I will turn it over. I think, Jonathan, you're up.
Yeah, thanks, Ceci. Hey everyone, I'm Jonathan Doster from the Autism Prevention Fund. In a few minutes, I'm going to discuss a pair of Illinois State Board of Education budget lines. But first, I wanted to begin with some information on the Early Intervention Program, otherwise known as EI. As most of you all know, through EI, eligible children and their families are entitled to receive a whole set of developmental, social, emotional, and health services designed to maximize their development. This includes speech and language, occupational and physical therapies, medical services, and psychological counseling, among other things. Illinois provides EI services to approximately 20,000 infants and toddlers annually, which totals about 3.5% of all 0 to 3-year-olds in the state. Estimates indicate, unfortunately, that as many as 13% of infants and toddlers in Illinois have delays that make them eligible for EI, meaning we're currently underserving a really vulnerable population of young children all across Illinois. much like the Childcare Assistance Program, we need to talk about both the FY15 and FY16 budgets for EI. The program itself began the year underfunded because it's a little technical, but an $8 million supplemental appropriation passed in fiscal year 14 wasn't annualized into that fiscal year 15 budget. So we began the year behind the 8 ball. In addition, we weren't necessarily surprised to see the need for some growth in the budget for EI this year. It's actually a good thing, which may sound somewhat counterintuitive, but what it means is we're now screening and catching far more children than ever before. The current shortfall is estimated by the Governor's Office of Management and Budget to be about $12 million, which is a rather significant number for a relatively small program. And as both David and Ceci mentioned earlier, the Department of Human Services stated at a recent briefing that it expects the sizable budget hole for EI and for childcare to be filled as part of a larger FY15 supplemental appropriation, but it's far from guaranteed, so we're still really nervous about the funding for the current year's program. As for fiscal year 16 budget proposal presented by Governor Rauner and his team, specific funding information for many programs haven't been released to the public, so we don't actually know how much money the governor proposes to direct to early intervention. We do know of one harmful policy proposal that's intended to shrink the state's overall caseload. Currently, again, this is a little technical, so bear with me when I try to explain it. Currently in Illinois, children are eligible for services if they exhibit a 30% developmental delay in any of the domains that are screened through the program or screened at your local pediatrician or wherever these developmental screenings actually happen. The administration is proposing to increase the definition of developmental delay from 30% to 50%. And a colleague of mine explains it this way. Understanding that all children develop in different ways and at different time frames, there are still milestones we consider somewhat regular. And if you imagine an on-track 2.5-year-old, a child exhibiting a 30% delay in, say, speech or language might talk like a 2-year-old as opposed to a 2.5-year-old, while a child exhibiting a 50% delay would actually be a full 18 months behind. It's a significant difference in children this young. So, we believe that restricting eligibility for EI to children who exhibit at least a 50% delay will leave thousands of infants and toddlers without any help in their critical first 3 years of life. It will also create a huge increase of children who will need more intensive and more costly services when they enter preschool and kindergarten. The irony of all this is that children with mild and moderate delays, which are sort of measured at 30 or 40%, make the most significant gains in early intervention. So the cost savings that they're hoping to extract from this programmatic rule change actually won't save the state much money, and it's going to exact an enormous amount of human cost on some of our youngest and most vulnerable children. Currently, only 3 states, Arizona, Alaska, and Missouri, as well as the District of Columbia, have implemented such a restrictive definition of eligibility. And I know a great many providers and parents are already pushing back on this proposed policy change, and we at the Ounce and others will report any important updates as we get them. I think that's it for EI for now. I'm going to spend my last minute or two updating. I think we can go to the next slide. So I'm going to spend my last minute or two updating everyone on a couple of programs run by the State Board of Ed. The first is the Early Childhood Block Grant. Again, as most everyone on the call knows, the block grant funds our state's Preschool for All program, as well as our Prevention Initiative program for infants, toddlers, and their families. Funding for the program peaked in fiscal year 2009 at $380 million. And over the last 6 years, the block grant has been cut down by $80 million, all the way down to $300 million. As a result of these cuts, we serve now in this current year 20,000 fewer children in preschool than we did just 5 years ago. It's really a staggering number. The way that we talk about it is that we've lost an entire generation of preschool-age children who could have been served by our valuable services here in Illinois. And back in January, as part of its budget process, the State Board of Ed actually recommended a $50 million increase to restore a considerable chunk of the recent cuts. Us advocates had pushed for a full restoration of the $80 million, but we're happy with ISB's intention to grow the program. This budget increase is also really important because the ISB proposal would satisfy a commitment that the state of Illinois made to the federal government as part of our preschool expansion grant application, which we were a recipient of in December. Many of you have probably heard about it now, as money is starting to go out to communities across the state to serve some of our state's most at-risk 4-year-olds. Last month at the budget address, Governor Rauner proposed a modest $25 million increase to the block grant. In light of the many devastating cuts that David detailed earlier, we appreciate the increase. However, we don't know whether it amounts, like the $25 million increase would actually satisfy the federal government with regard to our commitment to the expansion grant. There will be further discussions in upcoming appropriations committees in Springfield, and we'll try to keep everybody posted with alerts from our organizations in the coming weeks. Outside of the block grant, I wanted to touch on one last ISB program, which is the bilingual education program. ISB provides funding for bilingual services, preschool through 12th grade. Like the block grant, bilingual ed saw its funding peak in fiscal year 2009 at $75 million a year. And also like the block grant, unfortunately, the bilingual line's been cut over the last 6 years. It's now budgeted at $63.5 million annually. During the budget hearings that the State Board held this winter, advocates pushed for a full restoration, which would be a $12 million increase to the program. ISB actually proposed a full restoration of the bilingual budget line too, which was really great. Governor Rauner's proposal is to fund the program at its current level, which I said earlier is at $63.5 million. We believe this is pretty problematic as the number of English language learners in our schools continue to rise. We also believe that sufficient funds must be appropriated in order to ensure that preschool children receive the service they're entitled to by statute. So we'll continue to push the legislature on the block grant cuts as well as the early childhood or the bilingual ed lines. And before I pass it on to Emily from Voices, David had noted that we would discuss the K through 12 budget. Similar to the block grant, Governor Rauner and his team had proposed a modest increase to our K through 12 general state aid, which would bring the proration rate, which is currently at 89%, up to 95%. Again, this is a good thing to do, is to fund the general state aid to the full foundation level. This would get us closer, but building an education budget on the cuts of other really critical programs is problematic, and so we'll keep watching this GSA amount as well as our ISB budget lines as the General Assembly actually builds its own budget. So I think that's it for me. I'm going to pass it over to Emily from Voices to discuss some additional budgetary concerns.
Great. Thanks, Jonathan. Hi, everyone. This is Emily from Voices. So one of the things that we think is very important to understand is that children don't thrive in a vacuum. Children thrive in the context of healthy families and healthy communities. And this budget is bad for families and communities pretty much across just about every issue that families and communities interact with. So it's important to really understand the breadth of impact that this proposed budget would have. Local governments are, it's proposed that their funding be cut in half, the amount of money that goes to local governments to be cut in half, which has the effect of shifting costs to the local level that the state has historically provided. There's been a lot of outcry from local governments. There was an editorial in the Bloomington Pantagraph this weekend basically saying that a budget that shifts the costs to local governments and at the same time cuts services and requires local governments to make up for those cut services, that's a bad deal for local governments. So you may hear some buzz about that in your local paper. Another area that was cut is public health. $22 million was cut from the general funds, which is about 16% of the total allocation. Some impacts directly to our population include about 10% cuts, 10% cuts to school health centers, perinatal services, and immunizations. And, particularly at a time when measles is in the headlines, that seems like a very bad move, just from a common sense perspective. Also, cut from the budget is funding to prevent sudden infant death syndrome, which is just very sad. Foster care is another area that came under fire, 20% cuts for foster care, and that comes in the form of children who are leaving the foster care system between the ages of 18 and 21 will lose services. These children have been identified as needing additional resources once they are no longer wards of the state in order to get their lives started. That was identified as a need a number of years ago when this legislation was passed. That need still exists, but 2,400 young adults will lose access to that service. Along with that is 475 fewer DCFS staff, DCFS staff, did I say that correctly? And cuts to counseling and education. Public transportation is going to take a hit. This isn't something that we've heard a lot about. I think we will. It's something that impacts low-income workers, high-income workers across the board. We're talking about fare hikes, service cuts, things that will make it harder for people to get to work to be able to provide for their families. Another significant cut that you've probably heard about is a cut to higher education. 30% of public university funding is slated to be cut. Governor Rauner has said that universities can make up for that through tuition increases. At the same time, he level funded the assistance program for low-income students to attend college. So the message there is universities can increase tuition and we will not provide additional assistance for low-income families to pursue higher education. So those are some of the additional budget concerns that exist outside the direct world of early childhood, but these all definitely have impact on the populations that we work with every day. And with that, we can move on to the next slide. Ceci?
Yeah, thanks, Emily. So we never, we never sit down and take bad news lightly or sitting still. And so we wanted to kind of go through some events that we each are planning in the coming months that provides an opportunity for you to have your voices heard, to come to Springfield, to do actions in your district, and to make sure that legislators as well as the governor understand the importance of these programs and the impact they have on communities. So we'll start with Illinois Action for Children, doing public policy through a grassroots organizing lens. We had a great rally for those of you who came. Thank you. The day after the governor's budget address on February 19th. In March, we were planning a day of action on Wednesday, March 11th. That's a week from this Wednesday. And we will be sending out information about that. And that action is really going to focus on the programmatic change that's been proposed for FY16 as it relates to school-age children, and really focus and highlight on the impact of that and reminding folks how little a 6-year-old really is. And so that will be actions both in Springfield as well as a way to participate back in your district. Our annual conference and lobby and day at the Capitol. So our Spring into Action conference this year is April 21st and 22nd, and that second day is really a day of action, and we'll be going over to the Capitol. And then finally, we do have our May rally scheduled on Wednesday, May 13th, and that will be a rally outside in front of the state capitol, rallying what I presume then will be the 16 budget and making sure that it is the best it can be for children and families. And through all of that, we always have a constant, focus on revenue. That is part of our messaging, that we believe that, as David pointed out, a cuts-only budget is not the solution, and so making sure that revenue is part of the conversation. I'll just go through this. So Voices for Illinois Children right now doesn't have, other than their Kids Count dinner, doesn't have anything scheduled, but stay tuned in Springfield. And then the Autism Prevention Fund has their Early Childhood Advocacy Day, which has grown tremendously over the years on Tuesday, April 28th, and bringing folks connected to providing services through the Early Childhood Block Grant has been really profound and had an impact over the years, and so that'll be on Tuesday, April 28th. So that's who we are.
I can actually just quickly add, this is Emily over at Voices. Part of what goes along with what Ceci was saying is the need for more revenue, which we are all very actively fighting for. If you have any desire to follow the revenue fight specifically, I encourage you to check out the Responsible Budget Coalition on Facebook, which is a group of over 100 nonprofits that have come together to call for more revenue. Also, if you would like to follow us on Twitter to stay up to date on news relating to budget issues, the handle is at RSPBudgetIL, RSPBudgetIL.
And we can get that out to folks as well. So those are the actions that we have, and we wanted absolutely to always allow time for questions. Chua Vu in our office at Illinois Action for Children is going to kind of moderate the questions, because I'm sure there's typically ones that, you know, we get a lot of the same questions, and so she's trying to group them. And so given that there are also multiple presenters, it makes sense for her to tell us who the question is geared towards. So I'm going to turn it over to Chua and for the question and answer session.
Thank you, Ceci. So there are a lot of questions coming in. The first one I'm actually going to pose to David from Voices. It's a general question, which is, will the FY16 budget be fully funded for next year?
I think the answer is we just don't know. You know, there are real deep shortfalls right now, and depending on what happens, you know, they ultimately have to, if they want to fund critical areas and, you know, have these programs exist and serve the populations that they need to exist, they need to raise the revenue. And if they don't raise the revenue, then they have, if they don't cut the programs, then they don't fully fund them. So, you know, this is really, you know, a question of what the General Assembly and Governor will ultimately do. You know, but the bottom line is that if you don't raise the revenue to fund some programs, then they won't be fully funded unless you actually just cut them and don't have them. So, you know, this is really a critical question, but I think we just don't know the answer to that yet.
Okay. Another question that we got is regarding the school age program cuts, which I'm going to send over to Ceci. The question is, on the proposed change to eliminate school age children, could the children keep eligibility if they're currently enrolled in existing early care and education and then age into school age programs?
Yes, as we understand it, and again, there's still a lot of detail that's missing from where we sit. But yes, as we understand it, this is just about new applicants coming into the program. So if you are 5 this year and you would be 6 next year, but you are consistently still, you know, and still in the child care assistance program on July 1st, then yes, you can automatically stay in the system. You have a case number, you have a provider, and that you would just continue, and that continuity would be there. It is for any families who are newly in need of child care assistance, or it's families who might be in right now. They're going to lose their job in February because it's a seasonal job, or they're going to lose their job in April because their job is snow plowing. They're going to become unemployed between kind of April 1st and sometime in July, when they could probably get some lawn care work. They're going to then need child care assistance again. They would not be able to re-enter the program because they would be seen as kind of a new client, so to speak. And so as we understand it, If you are constantly in between now and July 1st, even though you're not school age now, but you will be come September, you can stay on. But if for any reason you fall off the Child Care Assistance Program, you then, with a school ager, would not be able to get back on after July 1st.
Okay. I have a question regarding the general kind of how is the Governor Rauner actually going to move money around and where is this money coming from? And so maybe, David, do you think you could answer this one?
I'm happy to try. I mean, others can chime in as well. Essentially, he has said he is against raising any new resources through, raising any new revenue, which means basically shifting money around the budget. And so that basically means, because they've not actually gone through with a lot of the grants and other things that that have been scheduled for this year, and are trying to save money there. That's part of where they'd be shifting money around. In the past, they've also gone to outside of the general funds. There are a bunch of other state funds that fund kind of dedicated purposes, and they could do what are called fund sweeps, where they just take money from various places. But I don't think we know exactly. It's still part of the ongoing negotiation. But he said he doesn't want to raise any new revenue, which means that there's no new money available in the system. You have to go someplace else, within state government and take that money.
And this is Ceci, and I don't know that, that's as much as we understand it. I mean, with no new money coming into the system, there are these other state funds. There are some lines that traditionally do underspend their appropriation. And so our understanding is that they would kind of look throughout every line in the budget and, potentially take a little from each place in order to come up with to fill the hole for child care. But as many of you know, there are a number of other programs. Jonathan mentioned EI is facing a crisis and a shortfall this fiscal year. We know that corrections will basically run out of money at the end of March, which is a significant amount and a significant service that those prison guards serve in this state. So there are a number of other, it's kind of one of those ships where you plug the hole and a bunch of other holes keep popping. And so how do you keep the boat afloat? But they are working at identifying those sources within the currently existing state budget that they could move money around from in order to address the crisis of child care.
Okay, thank you, Ceci. This question is for Jonathan. There's two questions on early intervention. One was if you could kind of repeat the eligibility issue again, and then also can you answer, who came up with this reduction in eligibility?
Yeah, thanks, Chua. So to answer the second part of the question first, the proposed rule change or proposed program change came from the governor's proposed budget. It was made public at a Department of Human Services budget briefing after the budget proposal was given by Governor Rauner. We don't have more details on how they got to the change in percentage from 30% developmental delay to 50% developmental delay. There are a whole host of folks who are trying to get to the bottom of this proposal and trying to figure out if it was a scientific decision or if it was just a way for them to cut services to kids. But again, so to even go back farther and to answer the first part of the question, currently in Illinois, children are eligible for services if they exhibit a 30% delay in any of the developmental delays that are screened. And so what the proposal would do would raise that eligibility percentage from 30 to 50. And so I don't know if this helps again, but the way that we imagine on-track 2.5-year-old talking and walking, a child exhibiting a 30% delay in some of those speech or other types of cognitive skills would be speaking or thinking like a 2-year-old. So they would be, approximately 6 months behind their peers. And the child exhibiting a 50% delay would be, 18 months behind their peers. So there's a significant difference in the way that children acquire their cognitive skills and the way that they deal and develop their social emotional skills, and those differences show up in kids at really young ages. And so restricting eligibility for EI to children who exhibit at least a 50% delay would leave thousands of kids who with mild and moderate delays out of the program, and those are the ones who make most significant gains through the program. So the whole, I hope that answers the question. It's a really bad policy, and we're hoping that there'll be some groundswell of support to try to push the governor and his team to change it.
Thanks, Jonathan. Since I have you on the line, there was also another question for you. You had touched a little bit on this in the PowerPoint, but the participant was wondering if you can say more about how this budget proposal is going to affect our state's dollars for the expansion grant.
Yeah, so the Governor's Office of Early Childhood Development put together our state's proposal for the preschool expansion grant at the end of last year. And as part of their ambitious plan, they there is a requirement from the state to increase the early childhood block grant by $50 million for the fiscal year 16. So, there are still some conversations that probably have to be had between the governor's office and the federal government as to what would happen with the preschool expansion grant dollars if this General Assembly doesn't appropriate a $50 million increase to the block grant. From what we know, there is maybe some wiggle room, but it's likely that we put together a proposal, the state of Illinois put together a proposal rather, and submitted to the feds, and we're expected to meet that requirement. And that requirement to get our $20 million grant from the feds is that we actually increase the block grant. So I hope that answers the question. There is, as part of the federal preschool expansion grant, which again is money that is going to be directed to communities to serve very at-risk 4-year-olds in full-day, full school day programs with wraparound services. We will need to be increasing the block grant annually to leverage those federal dollars, and we'll see what happens when the General Assembly actually puts together their budget proposals.
Okay, thank you. I have a question in terms of in our conversation for the need for revenue, and I'm going to direct this either to David or Emily. Is the need for a graduate income tax part of the message around revenue?
Can you repeat that? I'm sorry, too. I didn't hear.
Graduate income tax. So, I mean, so at Voices, we think that a graduated income tax is a very worthwhile long-term goal. Both because it, is based on ability to pay rather than just being, not based on ability to pay. The problem for next year is about timing. That because you would need a constitutional amendment, the earliest, my understanding that could happen would be to change the Constitution would be in 2016, in November 2015. So that doesn't help you for next year's budget. So it definitely is an important longer-term goal that I think would help, but it doesn't help with the FY16 budget.
And I will add that the speaker has expressed, the speaker, Mike Madigan, has expressed support for additional revenue. At this point, in terms of what's coming out of his mouth is the actual plan for new revenue. He has floated the idea of a millionaire tax, which is sort of the same as progressive. It's not as progressive as maybe we would like, but it is a graduated income tax. That would be the same as the process that David just outlined. It would have to go onto the ballot and be a constitutional amendment. So in terms of immediate fixes for our revenue, for the lack of revenue, a progressive income tax does not address those needs. We really have to actually increase current tax rates.
Okay, thank you. This question is for Ceci. There's been several questions around child care provider payments. I'm going to try to sum them up as much as I can. I think there's questions around how is this delayed payment really working? Does that mean that they will get paid at all? When, how does the payment work? Is it first in, first out? If you can kind of clarify generally, especially for those that are delayed, when do we think we'll expect a payment to be made?
Yeah, I can try. So it basically is a first in, first out. It was raised to us and brought to our attention that when we talked about the combination, the sharing of resources between the federal and the state, that people thought that, oh, well, the state's portion won't get paid out, but the feds will pay out something to everybody. And that's just not how it works. We don't really have a mechanism to kind of pay a partial bill, so to speak. And so, if I got my bills in on February 1st, then I was paid in February. So I was paid for, and remember that we, the providers on the phone absolutely know you're paid after services are provided, right? So it's a fee for service, so to speak. So you provided services in the month of January, and you submit your bills, and basically, as we understand it, if you submitted bills in the first kind of 8 to 10 days, roughly, in the month of February, then there was enough money in the bank come the 15th. So the bills start coming every day, right? We didn't pull down federal money until February 15th. That's the day that the feds deposit those monies into our bank account. So they use the monies that they pull down from the federal government, about $40 million, to pay the bills, and they paid as many bills as they could until there was no more money left. And then those, wherever they stopped in line in terms of the bills, that's where they will pick up next month. But they didn't have enough to get through February, and now we have to wait till March 15th before we have additional dollars that are deposited into our account, so to speak. So it is a first in, first paid. Nobody's getting kind of partial payments based on what split of a bill is federally paid versus state paid. And that's, and so we understand that it's running at about a 6-week delay right now, and it will only get worse because as more bills come in, we still only have the same amount of money to pull down on the same day every month, which is the 15th, and it's around $40 million, which is only about 45% of the state's monthly bills for child care. So it is kind of a bit of a perfect storm in terms of the payment delays are real, they're current, and they will get worse. So I hope that's helpful.
Thank you. So this is the last question, and I'm going to give this to either David or Emily, since you guys are together. But there's a lot of questions about what does this mean. So, what is next now that they're, can you describe the process? Now there's this governor's budget proposal. What happens next after this in terms of the process?
So the budget process will be the same this year as it has been every other year in terms of, the appropriations hearings that happen in Springfield. The added feature will be that we really have to come together to provide very personal testimony and provide personal stories about the way that this budget impacts our families and communities. So we've been involved, before, and now it's even more important than it ever has been that we are able to, as advocates, really gather the stories of the people that we work with, so that lawmakers and the press can understand who it is that's going to be impacted. I think we're in for a long one. the legislative session is typically, well, it's over on May 31st. But if a budget has not been agreed to by then, we will continue to work, and there's every indication that we will unfortunately be working all summer to bring this home for the families and communities that depend on our advocacy. So the actual budget process will look similar in terms of things that are scheduled, hearings, but what will be even more evident is the outreach that we as advocates will need to do to really bring in these personal stories.
Yes, and I just wanted to make a quick plug since we didn't mention it previously. Voices is releasing its Illinois Kids Count report this Thursday, which will have a lot of data on child poverty, and it's focused on child poverty this year. And so definitely look out for that, because I think that can be helpful in helping to draw the picture of why children are so important. We also have an event next Thursday, the 12th, in Chicago, a symposium with former Vice President Biden's former economist, who will talk about a lot of these issues in terms of why it's so important to fund investments in children and families. And so you can check that out and register on our website, which is voices4kids.org.
Thank you, David. On that note, there were a few questions about how do we share our advocacy activities with our various organizations, and I'd probably say for Voices, for Illinois Children for Prevention Fund, and Illinois Action for Children. If you're doing some great advocacy activities, feel free to share them on, if you have Facebook, tag us on your Facebook. I think we all have general emails on our website that you can email to us. We'll share contact information if you also want to share via email the work that you guys are doing around the state. We'll gladly share with other people. And there were also questions about the slides and the webinar. So we are recording the webinar, and we'll be sharing the link to the webinar recording as well as the slides. Will be made available definitely for sure on our website, but we'll send out an email to all the participants on that. On that note, I think we are hitting our time, and we want to thank everyone for joining us today for this webinar. It was a great panel and a great presentation. And if you have other questions, feel free to email us. I think we have contact information at the end of the slide. And so thank you, everyone.